The following segment is sponsored by Wasatch Medical Clinic. As the weather gets cold outside, we want to make sure you're having a good time with your partner indoors. Andrew with Wasatch Medical is here to tell us about a new treatment for ED. Andrew, welcome back.
Thanks for having me.
So let's talk about this new treatment. Can you explain that a little bit?
Well, just like technology has changed a lot of aspects of our life, it now finally has changed how we treat ED, not with a pill. It's called acoustic wave therapy. This is a device that emits pressure waves. Those pressure waves gently repair and open up blood vessels. It treats the root cause problem of ED. There you can kind of see how blood vessels die and age on the left, what we can do on the right. It improves circulation enough, we can get rid of the erectile dysfunction at its core without pills.
And how is this different from other ED treatments?
Well, most of the other treatments have been pills and injections. They go to really the symptoms of erectile dysfunction. Men are playing a big timing game. There's no spontaneity, there's side effects. That's why it's different. This goes to the root cause. No chemicals means no side effects.
Okay, perfect. So no side effects. You talked about it. If we don't treat ED, will it get worse?
I hate to say it, but yes, it typically does get worse. I compare it to eyesight and hearing. Once you start having some issues, it progressively generally does get worse. It doesn't just fix itself on its own.
So how many procedures does it take before you start seeing results?
Cambridge did a study on this exact question. They said the average guy needs a few 10-minute sessions over about 2 weeks. So that's your process. Not something you typically have to repeat, by the way. Pretty cool to think that your erectile dysfunction could be gone 2 weeks from now.
Okay, and you mentioned this a little bit. How long does the procedure take?
It is very easy, quicker than you'd think. 10 minutes. We call it the lunch break treatment. Come in on your lunch break, leave feeling totally normal. No pain, no recovery time, no side effects.
No recovery time, great. So what would you say to someone who maybe isn't having ED problems right now? Why is it important to remember what you're saying?
Well, just because most men will struggle eventually. That's the first thing I'd say.
You're
the other
just
thing
being
is,
honest.
yes, this happens to so many. The other thing I'd say is we treat a lot of men in their 20s, 30s, and 40s that want to top off their drink, so to speak. They just want to improve frequency in the bedroom. It's all about the blood flow, and we do a lot of that.
So what if maybe you are having a hard time talking to your partner?
Yeah.
What is the best way to talk to them about Wasatch Medical?
Many spouses call us every day and say, my man is struggling with erectile dysfunction. What do? I don't want to talk about it. I think starting with a positive, which is I want to improve the intimacy, that is a great thing.
Okay, starting with the positive and then heading on to Wasatch Medical Clinic. Where can we find Wasatch Medical Clinic?
You can go to wasatchmedicalclinic.com or just call the number on your screen. We'll do a screening, exam, and blood flow ultrasound at no charge with our medical doctor, and that's the first step.
Perfect, love it. Andrew, thank you so much for being here with us. We really appreciate it.